All right, let's dive into this deep dive on type 2 diabetes medications and insulin.
Yeah.
We're going to try and really help you guys listening understand how these treatments kind of go above and beyond just diet and exercise, help you guys manage your blood sugar.
Yeah.
And I know, it can be like really overwhelming
Yeah.
when you're first starting out with all this stuff.
Absolutely.
So we're going to like break it all down.
We'll explain what those common medications are, when and how insulin might become like part of your treatment plan, and give you some good tips on how to have good conversations with your doctor.
Yeah, and just to add to that, it's really empowering
Yes.
to understand these tools
Absolutely.
for, better blood sugar control and really like overall managing your health.
Yeah.
So let's imagine
Yeah.
you've just been diagnosed with type 2 diabetes.
Right.
One of the first things your doctor might talk to you about is metformin.
Yes.
It's often the first line of defense.
It is, yeah. A lot of times people will start with metformin. It's really interesting. It works a couple of ways. First, it helps to reduce the amount of glucose your liver makes. And second, it improves your body's sensitivity to insulin, which is a big deal.
Okay, so before we go any further, can you explain what insulin resistance is and like why it matters in type 2 diabetes?
Sure. So insulin resistance, it means your body's cells aren't responding to insulin the way they should.
Gotcha.
So insulin's kind of like a key
Okay.
that unlocks the door for glucose to enter the cells to be used for energy. When you have insulin resistance, that key doesn't work as well,
Ah, okay.
and glucose builds up in your bloodstream.
So metformin is kind of like it helps to make the cells more responsive to insulin, like oiling the lock.
Yes,
So the key turns more smoothly.
that's a great analogy.
Oh, good. Okay.
And one practical tip about metformin, taking it with food can really help if you get an upset stomach.
I've heard that. Yeah, that's good to know. So metformin is often like the starting point. What other medications might someone with type 2 diabetes be prescribed?
Well, another group or class of medications is called sulfonylureas. You might hear names like glipizide or glyburide. And those meds stimulate your pancreas to release more insulin.
Okay, so instead of making the cells more sensitive to insulin, these medications actually encourage your body to produce more insulin.
That's right. And while they can be really effective, it's important to be aware of the side effects. And one of the big ones is low blood sugar.
So I bet that means that mindful eating is super important for people on sulfonylureas, like not skipping meals, making sure you're eating regularly throughout the day.
Yeah, keeping a good schedule for eating and balancing your nutrition is key.
Got it. Now, I've heard about these SGLT2 inhibitors.
Yes.
They sound very complex. What can you tell us about them?
They are fascinating. SGLT2 inhibitors work in a totally different way than those other meds we just talked about. They actually work on your kidneys, helping them to remove extra glucose through your urine.
Wow, so it's like a whole different pathway
Totally different.
to lower blood sugar.
Yes. And this is what's really cool. Research shows that SGLT2 inhibitors can lower your chances of heart failure,
Oh, wow.
even if you didn't have a heart problem before.
I had no idea. So it's not even just managing blood sugar, it's protecting your heart too.
Exactly. And that actually leads us to another group of medications that are becoming super popular called GLP-1 receptor agonists.
Okay, GLP-1 receptor agonists. I have heard good things about these. Tell me more.
So these meds work by acting like a hormone that your body makes that helps regulate blood sugar.
All
They have this added benefit that they reduce your appetite and help with weight loss.
Wait, so these medications can actually help you lose weight too. That seems like a win-win for a lot of folks.
Yeah. It can be. And there are different ways you can take them. Some are weekly injections, and others are pills now.
So there's more flexibility now, which is great. Are there any like drawbacks, things people should be aware of?
Like any medication, there are potential side effects, and it's
Yeah.
important to talk to your doctor about any concerns.
Yeah. I think that's good advice for any medication, really.
Mhm.
So far we've covered metformin, sulfonylureas, SGLT2 inhibitors, and GLP-1 receptor agonists.
You got it.
Are there any other medications we should know about?
There are a couple others, but those are the ones you'll hear about the most. And sometimes a doctor might have you take a couple of these medications together to get your blood sugar just right.
Makes sense. It's all about finding the right treatment plan for you. Now, we've been focusing a lot on these medications you take by mouth, but what about insulin? When does that come in?
Right. So insulin is often added on when those other medications aren't enough to keep your blood sugar in a good range. Sometimes you'll need it during stressful times if you get sick or have surgery. Your blood sugar tends to go up and down more in those situations.
So it's not necessarily like a sign that you've done something wrong or that your diabetes is out of control or something like
Yeah,
that.
not at all. It's just another tool to help you manage your blood sugar.
Okay, good. Good, good, good.
Yeah.
Because I think there's a lot of fear around insulin,
Oh, yeah.
a lot of misunderstanding.
Yeah.
So let's kind of break it down.
Okay.
What are the different types of insulin?
Well, there are three main types. Basal insulin is long-acting, and it gives you a steady level of insulin throughout the day and night.
Okay.
It's kind of like your foundation.
Like your baseline.
Exactly, providing a baseline level of control for your blood sugar.
Okay, so basal insulin is like this slow, steady release. What about when you have like spikes in your blood sugar, after you eat?
Exactly, and that's where bolus insulin comes in. Bolus insulin is short-acting, and you use it to manage those spikes after you eat. So you take it before meals, and it helps to cover the rise in blood sugar from the food.
So like basal is like the foundation and bolus is like the extra support.
I like that.
Okay.
Got it. And then there's premixed insulin, which is kind of like a two-in-one. It has both basal and bolus in a single injection.
Okay.
And it can be much easier for some people because it makes the dosing simpler.
So
Oh.
so depending on your needs, your lifestyle, there are different types of insulin that might work well for you.
Absolutely. Your doctor will work with you to figure out what kind of insulin and how much you need for your situation. Now that we've talked about the types of insulin, let's think about how it actually gets into your body.
Insulin delivery methods.
Mm.
Most people probably think about the needles, the syringes, but what other options are there?
You're right, a lot of people think about syringes first. But actually, these days, insulin pens are way more common. They're small and super easy to use, especially when you're not at home.
Yeah, that makes sense. And what about those insulin pumps? I've heard about those.
Oh yeah, insulin pumps are really great for some people. They give you a steady, customized dose of insulin. It's a small device you wear on your body. Basically, it's like a tiny little insulin dispenser.
So it takes some of the guesswork out and you don't need so many injections every day.
Exactly. And the technology is getting even better now. There are smart pens that keep track of your insulin doses and can connect to apps on your phone. And there are closed loop systems that actually watch your blood sugar and change how much insulin you get automatically.
Wow. Sounds like the technology is changing so fast.
It is. It really is. And it's helping people with diabetes so much, giving them more control, making things easier, and helping them feel less worried.
That's great to hear. Okay, so we've talked about the types of insulin and how you take it. But I think it's important to say that starting insulin can be a really big decision. It's not always easy emotionally.
You're so right. A lot of people get overwhelmed or scared when they hear they need to start insulin. Some people are worried about the injections, and others feel like they've somehow failed or that their diabetes is getting worse.
Yeah, I mean, it's a big change.
Right.
And there's still a lot of stigma around insulin.
Absolutely. That's why it's so important to talk openly with your doctor and nurses. They can answer your questions, give you support, and help you make the best choice for your health.
And remember, insulin's just another tool, like those medications we talked about.
Right. It's not a punishment. It's just a way to give your body the insulin it needs to work right and keep your blood sugar where it should be.
So we've been talking a lot about medications and technology.
Yeah.
What about lifestyle? How important is that for managing diabetes?
Oh, lifestyle is crucial. It's really the foundation for taking good care of yourself when you have diabetes. It means eating healthy, being active, getting enough sleep, and finding healthy ways to manage stress.
So it's not just about what you eat, but how you move your body, how you rest, and how you handle all the ups and downs of life.
Exactly. It's about taking care of your whole self.
Okay, let's get into some practical tips for building healthy habits into your life. Where's a good place to start?
Well, when it comes to food, focus on real whole foods instead of those processed packaged things. Lots of fruits and veggies, whole grains, lean proteins, and healthy fats.
So making small changes instead of trying to change everything at once.
Yeah, exactly. And don't be afraid to get help from a dietitian or a diabetes educator. They can help you plan meals that fit your needs and what you like.
That's a great tip. What about exercise? How much should you do and what kinds are best for people with diabetes?
A good goal is at least 150 minutes of moderate exercise each week, spread out over a few days. It could be brisk walking, swimming, biking, dancing, anything that gets your heart rate up.
Find something you enjoy and make it a regular thing.
Exactly. It shouldn't feel like a chore.
Right. It should be something you look forward to. And don't forget about strength training. Building muscle helps your body use insulin better too.
Yes. Aim for a couple of strength training sessions each week, working those major muscle groups.
Now, I know sleep is something people don't always think about, but it's really important for your health. How does sleep affect your blood sugar?
That's a great question. When you don't get enough sleep, your body makes more of this stress hormone called cortisol, and that can make your body resistant to insulin and your blood sugar goes up.
So getting a good night's sleep is a key part of managing diabetes.
It really is. Try to get 7 or 8 hours of good sleep each night.
Okay, noted. And what about stress? It's part of everyone's life.
Yeah.
How can people with diabetes handle stress in a healthy way?
Stress can definitely make your blood sugar go up, so finding ways to relax and cope is really important. It might be things like exercise, yoga, meditation, spending time in nature, or connecting with people you love.
So figuring out what helps you relax and making time for it every day.
Exactly. It's about self-care and taking care of your mental and emotional health.
Speaking of self-care, I think we should talk about the emotional side of living with diabetes. It's something you have to think about all the time, and it can be really hard on you mentally.
It's true. A lot of people with diabetes feel guilty or frustrated or anxious or even depressed. It's tough to always be checking your blood sugar and making healthy choices and worrying about complications. It can feel like a lot.
So what can people do to deal with these feelings?
Well, the first thing is to just admit that you're feeling those things. Don't try to bottle them up. Talk to your doctor or a therapist or join a support group. There's no shame in getting help.
It's about realizing you don't have to go through this alone.
Exactly. There are so many people out there who know exactly what you're going through and they want to help and support you.
We talked before about how important it is to keep learning about diabetes. Why is that so important?
Because diabetes is complicated and researchers are always learning more. There are always new treatments, technologies, and ways to manage diabetes. It's important to stay up to date so you can make good decisions about your care and speak up for what you need.
So you're really a partner in your own healthcare.
Absolutely. Don't be afraid to ask questions or look for the latest information.
Okay, so we've covered a lot. From medications and insulin to lifestyle changes and the emotional side of living with diabetes.
It's been a great conversation. But before we finish up this part, I want to emphasize one thing.
Yeah.
It's easy to feel like diabetes is running your whole life. You have to think about your meds all the time. Check your blood sugar. Make different choices about food. It's a lot.
It really is a lot to handle.
Yeah,
But I think the important thing is that you're not just your diabetes.
that's so true.
It's a part of you, but it doesn't have to be everything.
Exactly.
So how do you find that balance? How do you actually live well with diabetes?
I think it starts with changing how you think about it. Instead of seeing diabetes as this like bad thing, try to see it as a chance to grow and learn about yourself.
Oh, that's interesting. I can see how that would make a big difference.
It really can. And it doesn't mean pretending that everything is easy.
Right.
It just means you're not letting the hard stuff take over.
So you're managing it,
Yeah.
but you're still living a good life.
Yeah. You're fitting diabetes into your life instead of letting it run the show.
Okay, I like that. Now, we've talked about all these healthy habits.
Right.
But what about those times when you just want to have like a piece of cake
Of course.
or enjoy a big meal with your family, you know?
Those are important times too. It's about finding that balance and making smart choices. You can still have treats sometimes. Maybe you adjust your meds or exercise a little more.
So it's not about never having fun. It's about making choices that work for you and your goals.
Exactly.
Oh.
And it's about not feeling guilty when you enjoy yourself.
That's so important because diabetes can feel limiting enough without adding a bunch of extra rules.
Right. It's all about finding what works for you and making a plan you can actually stick with.
We haven't really talked about this yet, but I think it's important to mention the role of community and connection when you have diabetes. Having support must make a big difference.
Oh, it's huge. Having people around you who understand what it's like is so important. It makes you feel like you belong and that you're not alone.
So family, friends, a support group, just having people to talk to.
Exactly. And don't be afraid to share your own story. Talking about what it's like to live with diabetes, the good and the bad, can really help you process things. It helps fight the stigma, and it might even inspire someone else.
It's true. When we share our experiences, it helps everyone understand and support each other.
And it reminds us that we're all in this together.
Well, I think we've covered so much in this deep dive. We've gone over the science of medications and insulin, all the practical stuff about managing diabetes day to day, and even the emotional and social parts that are so important.
We really wanted to give you a complete picture of what it's like to live with diabetes and manage it well.
And I hope you're walking away from this feeling like you know more and like you have some tools to help you.
Me too. And remember, even though diabetes is a part of your life, you can still have a really great life.
That's a great message to end on. So what's the one thing you want our listeners to take away from this?
I want them to feel confident that they can manage their diabetes and that they can still live a full and happy life.
I love that.
Yeah.
And remember, if you have any questions or you just want to connect, reach out to us. We're here to help you.
Absolutely. Until next time, keep learning, keep taking care of yourselves, and keep living your best lives.
Thanks for joining us on the Deep Dive. We'll see you next time.